Okay, so we're going to wrap up. Let me just take 30 seconds and say thank you for that fabulous panel. Marcia, step down. That's fine. You can come back up. I love it. It's all good. Thank you all for staying with us and engaging. And you know what as I listen to these four presentations, four sets of discussions, moderated expertly by Ingrid, the sense you get is history teaches you not just how you got here and the challenges that we faced, but also teaches you all the times you got it right and then abandoned it, which is really interesting because that's not something we think about, right? It's if you don't study history, you're doomed to repeat the mistakes. Sometimes you forget the successes. And the examples from Brazil are extraordinary on that. And Emmanuel, your story about not just engaging, but with faith healers really being at the center of the response. And it's interesting, Gabriela, as you talked about Mexico, last night's discussion was about pandemics in the context of failed states. And the idea of a country coming out of a 7-year, 8-year political struggle, how that hampers its ability to deal is really extraordinary. So I thought this was an incredibly important discussion. I'm going to just finish with one visual that I have, and then I'm going to turn it over to one of my colleagues just to talk about these panels. A couple of years ago, I put together a course on Ebola and had the extraordinary privilege of having people like Paul Farmer in the course. But of course, there was no way to put together a course on Ebola and what it meant without having our keynote speaker, Alan Brandt. And one of the images for me from that course in that discussion is something that got brought up again today, which is, the U.S. military is an extraordinary institution. It can get to anywhere in the world in very short time period and deal with the most crazy threats. And it took 3 to 4 months for the U.S. military, after our commander-in-chief said we're going to do this, to get to West Africa. A reminder of how incredibly ill-equipped it is to deal with disease and health challenges. It can do many things, it can't do that. But the image that is in my mind, sort of burnt in my brain about that whole thing, is it arrived, the disease was on its wane, they set up all these camps, no one showed up. So they shut all those camps down. They took all that infrastructure and brought it back home. Like, what an extraordinary loss. Like, here was an opportunity to do something good and useful for the long run, but the mission was tightly defined, and when the mission was over, everybody left. And so we've talked a lot about how disease outbreaks fuel investments in infrastructure, and one can't help feel like that was an incredible lost opportunity. But I do want to finish by saying there have been successes, and I think we can look to our history for those. Let me ask Shauna Jansen, who's a senior program manager at the Global Health Institute, who really kind of conceived of this outbreak week and has been really central to all of this. And everybody got up here and thanked me. You all know I had a tiny amount to do with this week. It was Shauna, it was Corey, Courtney, Maroke, a whole host of people who've done an extraordinary job. But Shauna, do you want to talk a little bit about the panels and finish up? Thank you.
Thank you so much, Ashish, and for your tremendous leadership and support for Outbreak Week and leading the pandemics portfolio more broadly. And thank you, panelists, for this enlightening conversation. I'd like to just take a quick moment to introduce the exhibit that we have here today. I know everyone is eager to get to the reception. We have a reception following from 5 to 6, thanks to the Dean's office. So I hope you'll stick around, wine and cheese, and have a chance to get to know one another and view this exhibit. So a little bit on this exhibit. We've been working with the Smithsonian Institute in Washington, D.C. for the last year and a half. Got very interested in this exhibit when we heard about it. First was inspired by the Ebola outbreak, and then also knowing that the centennial was coming up, the Institute as well as HJHI got very interested in using this exhibit as a platform to create a global dialogue around infectious disease outbreaks, not just here at Harvard, but around the world. We were very interested in the content in part because it was an intersectoral, interdisciplinary approach to infectious diseases. But also, as we've been talking about today, this exhibit has the capacity to be tailored to each environment that it goes to. We're really lucky to have 8 panels here today that were developed by Harvard faculty and institutions. 4 of them will be in this room. The other 3 are over at the Countway Library for an event that we have at 6:30 tonight. And Dr. Dan Lucy, are you here in the audience right now? He's not, but he will be over at the Countway at 6:30. He was the original creator of this exhibit. We also have several of the leading technical experts who weighed into it here this week for Outbreak Week, including Dr. Larry Madoff of the Massachusetts Department of Public Health, one of the key leaders at USAID that is overseeing emerging pandemic threats all over the world, John Epstein from the EcoHealth Alliance, and many others. We're grateful for these contributions and to have them here this week. So just to give you a little overview of the exhibit, one of the core themes is One Health. And this idea that human disease, as we look at it as it spreads across human populations, it's not just about humans. It's really about animals, microbes, our environment, and the planet. And when we talk about ways that we can come together around infectious diseases, one of them being that we can protect our children. I think another is that we need to take care of our planet and our environment. So the idea of zoonoses is a core theme here, where through human actions in the destruction of the environment or habitat, these climate change, deforestation, pollution, overpopulation can lead to disease spillovers, which we now know are zoonoses. Ebola virus, SARS, Lyme disease, many others. 6 out of 10 human diseases, in fact, come from animals. So these are all explored in these panels here. I encourage you to check it out, ask questions. And I also would like to say that HGHI is committed, thank you to Ashish, to bringing this exhibit to 20 countries around the world. We want to make this content accessible to the places that are affected by disease outbreaks, perhaps even more than we are here, that may not have the resources to contain them. We've already forged partnerships with over 15 countries and are working with faculty here, Professor Soto Laviaga, Professor Marcia Castro. We have exhibits lined up in Brazil, Mexico, Chile, Argentina, Thailand, Vietnam, South Africa through the Harvard Center for African Studies. So if you're here today and you do research somewhere in the world where you think this exhibit would be beneficial, please come talk to myself or my colleague Ambika Lal. Ambika, can you please stand up? Ambika is helping to lead the global expansion efforts, and we would love to make that happen for you. I'd also like to briefly acknowledge our technology partner in this exhibit. We've established a partnership with Simpris Technology. You'll see their logo at the bottom. They're a mass customization platform. They own Vistaprint and many other printing companies around the world. And they have generously donated support for bringing this exhibit all around the world. So we printed this today through their platform, and we will be printing it all over the world for these other exhibits. So thank you so much for coming. And I would just like to briefly highlight 2 events that we have this week that I think you might enjoy that still have space. One is tomorrow's film screening of Contagion from 6 to 9. That's going to be at the brand new Smith Campus Center. And we have screenwriter Scott Burns joining us. And if you have not seen that film already, I highly recommend it. It's one of the best medical thrillers that depicts how a major pathogen could play itself out in society today. And then on Friday is our main flagship event. Dr. Anthony Fauci, director of NIAID, as well as 15 experts from around the world, the WHO, CDC, USAID, many companies engaged in health security, and the World Economic Forum will all be there. There's still space. So come talk to one of us or sign up on our website. And I hope you'll join us. So thank you.
Almost on one last comment. Marcia asked me to say this, and I have to do it because it's an extraordinarily important thing. For those of you who don't know, this is the 50th anniversary of something called ORT, oral rehydration therapy. And one of the key architects of that is a gentleman sitting in the back row trying to hide named Richard Cash. And for those of you who are not aware, ORT has saved millions and millions of lives, and we owe him a huge debt of gratitude. So a little round of applause for Richard. And there should be wine and cheese somewhere, but the reception has started. Thank you all very much for coming this evening.